Namaskar, welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring experts from Apollo hospitals every week to a live show where you can ask your questions in the YouTube chat box and we bring out answers from the experts. Also on the show, we have a health quiz. You can win prizes from Apollo 24/7. I urge you and request you to download Apollo 24/7, which brings a lot of benefits in your healthcare. So you also can win prizes. We are also going to share you gift vouchers and coupons, which you can use on Apollo 24/7. That's going to be towards the end of the show. So stay put, hold on. And today we're going to talk about cancer. Cancer in men. What are the myths, facts, the latest advancements in treatment options? We're going to talk everything about it. And today we are having one of the best expert, Dr. Sujith Kumar Mullapally, Senior Medical Oncologist from Apollo Proton Cancer Center, Chennai. And you must be knowing that Apollo Hospital has one of the India's best proton therapy center, cancer center in Chennai. And it's my privilege to introduce Dr. Sujith Kumar Mullapally. Here's his profile. He's a senior medical oncologist from Apollo Proton Cancer Center, Chennai, with more than 10 years of experience, 9+ years. And he specializes in the treatment of acute lymphoblastic leukemias, hairy cell leukemia, renal care carcinoma, ovarian cysts, and gastric cancers as well. A lot of professional memberships that Sir has, and he's received various awards, various conferences in the Pioneering Oncology and Pioneering Oncology Resident Award. He's published many papers as well. So let me welcome Dr. Sujith Kumar Mullapally to the show. Good morning, Doctor. Namaskar and welcome to the show.
And thank you so much for having me in the show. And it's my privilege to be part of this show because this month is World Cancer Awareness Day, and it's my duty to be here to discuss about cancer awareness and especially regarding cancer in men. Thank you so much for inviting. Yeah.
Thank you so much, Doctor. And it is our pleasure to have you here because we understand being a medical oncologist is always a busy time. You never get rest. But this Sunday also, you're here with us. I understand the kind of awareness that you would want to spread. As you said, February, it's not just 1 month that we need to raise this campaign of awareness, but yes, this calls for a bigger call. So today we are going to discuss about cancer, but let me narrow down cancer in men because it's not that we are going to isolate women out, but we would want to talk about cancer in men. So, Dr. Sujit, what, in your opinion, in India, are the cancers which are affecting men in larger numbers?
Yes, so as you said, cancer in men is many times not a discussed topic. We have an Pink October for women. We have so many activities for women. So we need to discuss cancers in men. And the most common cancers in men, in terms of the global scale, is most commonly it is lung cancer, followed by prostate cancer and colon cancer. But in India, we have a different scenario where we have the head and neck cancers being the most common cancers. And the common reason is that there is a lot of tobacco use, both in
Right.
smoking and as oral tobacco. So the first cancer that is in most common is head and neck cancer, followed by lung cancer, and then there is stomach cancers, colon cancer. The prostate cancer comes in the number 5.
Okay, okay. So while we talk about cancer in men, as you've rightly pointed out, these are the habits that we have picked up, जैसे smoking and alcohol or other kind of lifestyle, what do you call, wrong lifestyle practices. Do you think that these have a larger effect in men and cancer?
You see, when you take in case of females or women, we have breast cancer. But in men, the most common cancer is head and neck and lung cancer. And I would say nearly 50% of the cancers that men have can be attributed to the two main risk factors, that is smoking and alcohol. Apart from that, the lifestyle changes which we are mentioning regarding diabetes. Diabetes is a common reason for cancer. Having obesity is one reason. Having more of what you call lack of physical activity is one cancer. So we cannot distinguish that between men and women. I would say in terms of the high risk behavior regarding smoking, alcohol, still, and also oral tobacco. You see, oral tobacco is one of the most common reason that we have more cancers of head and neck, that is the oral cavity, the tongue, lips, etc. in men. So I would say yes, around 50% of the cancers in men are attributed to high risk behavior. And
Yeah.
this forum should be, the listeners should be knowing that these habits definitely are linked to cancer.
Yes, doctor, I would 100% agree on this. I have lost my father very recently, 8 months ago, to lung cancer, and he was a smoker. So it's not about how many years that you're living, it's also about what kind of quality life that you are living that matters. Though he's quit, yeah, he's realized and he's quit for a good time. That did not help him. That's what I wanted to bring it to your notice. So, what is a harmful smoking? I've smoked one packet in the entire year. So, is there a data that can prove that smoking is directly related to some form of cancer?
Yes, you see, we as oncologists, we do see people or patients, human beings with cancer. We say we don't call them patients. They come to us in a stage. Out of 10 patients we see, unfortunately, there are 6 or 7 are having stage 4. And why it is because the symptoms are picked up later. So there is something known as screening, and screening
Yeah.
means to detect cancer before they become symptomatic. And in case of
Correct.
lung cancer, there is a screening protocol in which men or female, either way, between 50 to 80 years, who have had more than 20 pack years of smoking. Now, one pack year means one packet a day for 1 year. So, 20 pack years could be one packet a day for 20 years, or it could even be two packet a day for 10 years. So, ultimately, the 20 pack years, if there is a history of smoking and they are between 50 to 80 years of age, they should get once a year low dose CT, which is not the common CT, but they're the low dose CT, which has less radiology exposure. That will help us to detect cancer in a much earlier stage. So when there was COVID pandemic going on, for the first time in our career, we used to see early cancers coming up because they would get screened for COVID and the small lesions would be picked up and they would be treated and cured completely. So that is one thing I would say, that screening for lung cancer is possible, especially in the high risk category, which I have said 20 pack years, that is one packet. So if someone is having a strong heavy smoking for more than 10 years or 20 years, and they have, even if they don't have symptoms, once a year getting a screening CT scan will help in detecting early cancers and not when they advance to stage 4 or stage 3.
Right, doctor. Thank you so much for that. In the meanwhile, audience who have joined, and I welcome you all because I see a lot of questions are Pavan, Ludwig, Shubham. All of you have typed your questions. May I request you to type the age and gender and other factors as well if you have any, because a lot of you have not typed your age, which should help in case of your father's Shubham. Please go type all the age, all possible details in one message. Please don't split your message. That's my request. So, Dr. Sujit, while you are saying that screening is possible and it is necessary, can we understand what are the different methods of screening for different cancers?
Yes, so for head and neck cancer, you see, the important thing is, I would always say that the knowledge about cancer is the most important thing. Now, for head and neck cancer, if it's in the lip or tongue, suppose you have an ulcer, suppose the person has an ulcer in the tongue or the lip which is not healing. Now, which even after taking antibiotics or vitamins, it's not healing, it is painless, then they should get it tested. It's called oral screening, that can be done by a dental doctor or a head and neck doctor. They see that, they take biopsy from it, and that can confirm. So oral screening will help for oral cancers, head and neck cancers. As I said, regarding lung cancer, we have the lung low dose CT scan. Regarding esophagus cancer or stomach cancer, suppose someone has a gastric problem or an abdominal pain which is not going in spite of taking antacids, and they have this high risk behavior of alcohol or smoking, it is okay to get, and especially if there is a weight loss, they should get a checkup done from the gastric doctor. Endoscopy may help to detect that cancer. And regarding prostate, now prostate, whenever we say cancer in men, everyone thinks about prostate, but we should understand the first three common causes are not prostate. As I said, it is head and neck, lung, and GI cancers. So for prostate, anyone above 60 years, if they have a urinary symptom like frequency, every time more than 2 or 3 times they have to get up in the night to pass urine, or they can't pass urine properly with a single flow, then they should get a test called PSA. We don't do it routinely, but if they have symptoms, PSA test will help. So I would say oral screening, then lung cancer for CT scan, then the endoscopy and PSA test would be helping us to find out the cancers at an early stage. and most importantly, the knowledge about these things is very, very important.
Absolutely, doctor. This is very important information, my dear audience. Please grab this as much as possible and spread the information. That's the very, very aim of this show. Right. Doctor, before I continue with my questions, there's one question that I would want to start off with the audience's question. Ludwig is this is 19-year-old male. There is swelling over my left testicle, but it doesn't have any pain. Is this a tumor? Do I need to get it tested or any other? He's just 19-year-old.
Right. And very important that he is aware about his body, that he understand that there is a swelling. So it is important. So for testicular tumors, which is exclusively for men, apart from prostate cancer, testicular cancers are very common in this age group that Mr. Ludwig has said. I'm sure it may not be, but it is important that he gets it checked by a urologist. Now there are some conditions like we called it as we have something known as there might be some benign reasons. Benign means non-cancerous reasons where the testicle may be larger than the left side testicle may be larger than the right side, but it is important to get it tested. How do you test it? There is an ultrasound test which is done, especially if it is painless. Now hydrocele is one thing which is painless, so it may also come as a testicular swelling. There are some young boys, they might be have some changes in the cord which can be taken as a testicular cancer, the testicular swelling. So the most important thing is to get it seen by a urologist, get an ultrasound of the testis. If it is testicular cancer, there would be some changes which can be detected, followed by some blood test, which we call as tumor markers. We don't do it like by directly to the lab. We go to the doctor, get it tested, and then do the test. We have some tests called AFP, beta HCG, LDH, etc., which help us to know. They are known as tumor markers. So next step for him would be to get it checked, get an ultrasound, followed by tumor marker testing.
Yes, and Ludwig, I think this is very, very important that you are aware of your body. Do not hesitate. This is just a part of your body. Do not hesitate in going and visiting a urologist. काफी हद तक ये होता है that people don't come out. They don't want to talk about it and they let it just remain like that. So I'm glad that this young boy is talking about it.
Yes,
And we
very
have,
true, very true.
even if it is, yeah, we wish and hope it is just nothing and just there, you can just be with it. Even if it is turning out to be something which is to be scary, we have examples like our cricketer stars who have beaten testicular cancer and got back onto the stage, yeah, onto.
On that note, testicular cancers are like more than 90% curable, and with treatment, they are curable. So they have a long life, they have a normal family life, and people do have a worry that if there is one side testicular cancer and they get the testis removed, does it affect their family life? I'm saying no. One testis is enough for having the family life. So it's most important is to be aware. No, we say cancer awareness is a personal thing, and it has to be. And I'm very happy that this topic has been discussed here. So it's very important that be aware of your body. Correct.
Wonderful, sir. Thank you so much. So, while you're talking about signs and symptoms to be aware, what are the basic signs and symptoms that men have to look out for? Alarms.
Yes. So if we go for the first, because there are so many cancers to discuss, we will just restrict ourselves to the first five common cancers, apart from the testicular cancer because it's exclusively for men. As I told, we'll start with testicular cancer. Any swelling in the testis which is painless, which has recently been noticed, which is increasing in size, and suppose there are any changes in the skin, which means it is progressing fast. That could be one sign of testicular cancer. That has to be noted. In case of prostate cancer, especially for people who are more than 55 or 60 years, having to get up in the night for passing urine more than two times, which has been increasing in that he has previously it was one time, now 4 or 5 times he has to get up to go to the washroom. Then having painful urination, having blood in urine, or having difficulty passing urine in a single stream. These are called as lower urinary tract symptoms. These are few symptoms which should be noticed. Suppose the cancer spreads somewhere, then only they have body pains or bone pain. So we should not wait for that. We should be looking for these symptoms. And regarding the lung cancer, a cough which is not subsiding in spite of a course of antibiotics, a cough which is bringing out blood out of the throat, a cough which is there for more than a month and we don't know what is the reason, a cough which is causing weight loss. this would be all a concern. You see, in our country, tuberculosis is one reason where this can happen, but tuberculosis can be detected by easy methods followed by further evaluation. And next is head and neck cancer. As I told you, any change of color of the lips or tongue, any ulcer, any mass in the tongue, any difficulty in swallowing, any painful swallowing, we should get it investigated. But the first thing is to go to the clinician, get it checked. Then only we should go for any scans. So I would say the symptoms are these. Most common symptoms are these.
Yeah. So, doctor, while you're talking about this, there was one question about PSA. Uh, Sanjay Vakhalu, is PSA the only indicator of prostate cancer? Uh, though medicines are that overcoming the urine retentions are provided for. That was the
So you see,
typed
yeah.
question. I hope you
No, no,
understood.
yes, yes. So you see, when I say that there is a urinary symptom like frequency or painful urination or hesitancy, uh, 10 out of out of 10, 9 times it would be what we call as benign prostatic hypertrophy. We call it BPH. And BPH is just with medicine. Sometimes they need a surgery, but most of the time with medicines it will be handled. That is from 65 to 70. But as the age increases, the more chances that the urinary symptoms can be detected to be because of cancer. So if a person of more than 80 years has these symptoms, I would say 5 out of 10 chances that he may have cancer. So PSA is not the only test. PSA is just a screening test, and it also helps us in monitoring the disease and the treatment
Right.
response. So once we have the PSA high, suppose you see the normal PSA for Indian men from 70 to 80 has been told as 7 cutoff. But for men who are less than 7 years, the PSA cutoff is only 4. So as the age goes, suppose someone has 15 PSA, they will need further evaluation. What is the evaluation? They get a urology examination, which called as rectal examination. They get an ultrasound and MRI, get a biopsy from the prostate. Prostatic biopsy is the golden standard to diagnose cancer. PSA high will not diagnose prostate cancer. The next, it's just a screening or a warning step to tell us yes, it is needed. It needs to be evaluated with biopsy or maybe an MRI, and then further it has to be done. So PSA is only a screening test. It is not diagnostic of prostate cancer.
Wonderful, doctor. So, Somroy ji, yes, we are going to talk about colorectal cancer as well. But before that, anyway, we have started our discussion with the prostate. Here's another question. Anjali Gupta is asking about her father, 65-year-old male, has an enlarged prostate from 4 to 5 years, and major issue is frequent urination even at night. But in MRI, circumscribed T2 hypointense nodule in central zone of prostate. Do we get a biopsy done?
Yes, so this would be, I congratulate her for being part of this talk. I'm sure so many daughters, wives, mothers would be here to listen. So that is again, so we have, it's like the family is like this. You're concerned about your father, that's great. So I would say this 67-year-old having 5 years of, gentleman having 5 years of urinary symptoms, definitely we need to evaluate. There would be a PSA test, definitely it has to be done, and the next step should be a biopsy because there is a focal lesion seen in the MRI. I would say they should get a what we call as, either we have something known as rectal ultrasound guided biopsy, or there is something known as transurethral biopsy. Either way, I would say that they should get a biopsy. And they have seen patients who have, or patients who have been told biopsy in their initial times, and when they hear biopsy, they feel it's a major surgery. They then go for alternative medicines, and then they come back when the condition is out of control. So I would use this forum, this platform, to tell the people here that biopsy is just a outpatient procedure. It's a, you go to the doctor, in half an hour it is done and you are back home, and it's nothing to be worried. It's an important procedure to confirm cancer. No PET scan, no MRI can diagnose cancer. So biopsy would be the next step, and followed by that, if biopsy comes as what I told as BPH, then no further worries. But because the MRI is showing a single lesion, we should be aware, and it should be a first stage cancer if we detect it now. So I would say
Yes.
yes, there needs to be a biopsy.
Great. Thank you so much for that very, very in-depth answer. And Jay Ravindranji, yes, Dr. Sujith is giving wonderful answers and she's complimented you on bringing on awareness. Thank you, Ms. Jay. Next, Tarini Munni. Sir, my father's a cardiac patient, swelling in hands. Okay, Tarni, I think you should type more question. Yeah, I am not getting the question there. All right, let me move on to the next question. Shyamdev Singh. Doctor, please let me know what are the screening procedures for throat cancer.
Throat cancer, yeah. So I have
Shyamdev Singh.
mentioned regarding yeah, I have mentioned. Thank you, Shamdevji. I am telling regarding throat cancer. Again, I said the symptoms have to be noted. A difficulty in swallowing solids, painful swallowing. What I say, having what you call blood coming out of the mouth when you are spitting, and all are symptoms of throat cancer. Some people have loss of their voice if the throat cancer increases more. So the most important thing here is to do a clinical examination by the doctor. There is one something known as, we call it as endoscopy, which is again an outpatient procedure where the doctor is able to see what is happening inside the throat, can see some lesions there, and can take a biopsy. So the steps would be that they meet a doctor, get it endoscopy. We have something known as laryngoscopy. They are all outpatient procedures, and they can get a biopsy. So that would be the a step to confirm, followed by we will be doing a CT scan or a PET scan to know the stage, and followed by that the treatment will start.
Wonderful, sir. Thank you so much. So here's a next question where Rajani Sinha, my sister is 60-year-old and is suffering from ILD, recently diagnosed with third stage lung cancer, 24/7 on oxygen support. Please advise.
You said it's what was the age of the person,
Person
patient?
is a 60-year-old, actually a female. It's not, today we wanted to dedicate it to men, but still I thought I should
So
take this question.
again, I would say again, it's just a chance that this discussion is happening here in this platform. You see, one thing we have to understand is among the lung cancer, there are different type of lung cancer, and one of them is called adenocarcinoma, which is most of the time seen in non-smokers and in females. And even if she has ILD, if we have a biopsy from that lung tissue saying adenocarcinoma, there is 70% chance that we will find some option to treat her only with tablets, and that is known as targeted therapy. Now, we in men also we have people who always come to me when they have a stage 4 cancer. They say, Doctor, I have been very fine all the years. I have never been against my health. I have never smoked. Why did I get the cancer? So now recently, in last 2 months back, there was a Nature paper saying that air pollution has contributed to rise of cancer in India and Singapore and China and most of these areas where there is pollution. And they are non-smokers, and they are mostly having adenocarcinoma. And in adenocarcinoma in smoke non-smokers, there is a chance that we can treat only with tablets, much better, no chemotherapy needed. But there are some tests which we call as molecular tests. So when we have this ILD means in oxygen means she may not be fit for a surgery or a radiation or any chemotherapy. But if we can take a biopsy, do the molecular tests, and get the cancer as some mutation positive, then we can give tablets and they will still survive for many years. So one thing I would to say the audience or the people who are joined is, treatment is not limited to chemotherapy nowadays. We have targeted therapy in lung cancer, which has changed the way cancer is managed. So we call it as personalized treatment. It is not like one person got chemo, so everyone should get chemo. It's not that. We have some tests, molecular tests, which will help us to decide personalized treatment and precision oncology. It's a good thing that that topic was brought in, and I would strongly urge that they should get a biopsy if possible and then start the treatment based on the molecular tests.
Wonderful. So, anyway, we are talking about targeted therapy. Here's a question about immunotherapy. Shubham Avasti, father 60-year-old and suffering from advanced OSCC and presently on cetuximab. Please guide me about the future available options. I've already gone through immunotherapy, but it did not help. What is immunotherapy, doctor?
Yes, so OSCC, basically what Mr. Shubham is asking is oral squamous cell carcinoma. So in the tongue cancers, it is usually oral cavity or tongue, it is squamous cell carcinoma. Now, again, as I told in the first, around 20% of all cancers in men in India are oral cancers. and it is related definitely to tobacco smoking and oral tube. So we don't need to think back, but who are listening, who are using this, should think about stopping it. That's why I put it the point for Mr. Shubham. So what immunotherapy basically means, you see, the cancer cells are from our own body. They are human cells which have become bad or which have become rogues. Now our immunity, when the cancer starts, somehow does not act against it because they are our own cells. So that is called as we have some check for our immunity working against the cancer. Now, what has happened is when we do immunotherapy, we are giving some medicines, usually as injections, that go to the body, turn on the immunity, make them more active against cancer cells, and they give good results, much better than chemotherapy. Now there is a catch there. Not all patients get benefit from immunotherapy, as Mr. Shubham said. There are some criteria, there are some markers which we call as biomarker. We do that, and if there is some positive result, then only we give immunotherapy. So immunotherapy basically are drugs which are given as IV or injections. They don't have the typical side effects of chemotherapy like hair loss, vomiting, or any blood count issues. They don't have the problems of chemotherapy like long injections or anything. They are usually 1 hour injections given over 2 to 3 every 2 weeks or 3 weeks, which work by activating the immunity of our body and acting them against the cancer. So there are some immunotherapies in lung cancer and in head and neck cancer which have worked so well that patients whom would have told that unfortunately we can't do much, the lifespan may not be more than a year and all, such patients are living more than 5 years. So that is actually the last decade of scientific advance. It got the people who discovered or invented immunotherapy got Nobel Prize because that has revolutionized the way cancer is treated. So in head and neck cancer, lung cancer, skin cancers, and gastric cancers, and all, immunotherapy has come in a big way. But always we have to choose the right patient. It's not for everyone, so the doctor has to choose the right patient and then only give, because immunotherapy is very costly. Unfortunately, at this point of time, we have some data coming from Tata Memorial saying that low dose of immunotherapy can help with 1/20th of the cost. So we are using it for our patients. In patients who can't afford, we have a combination called metronomic chemo and low dose immunotherapy, which cost, I would say, still they are costly, but it would cost less, 1/10th of the cost, 1/20th of the cost it would have. So immunotherapy is definitely an important, I would say, weapon against cancer for us oncologists and the families.
Yeah, so once he is done, now that they've tried immunotherapy which didn't work, what are the other options that he can think of?
Yeah, yeah. So he mentioned the drug called cetuximab. Now, cetuximab is as a targeted therapy. So we have spoken about immunotherapy. Now, cetuximab is a targeted therapy which is very much proven in case of oral cancers. So cetuximab, along with chemotherapy, is the way. We have to see how many. We have to give at least 4 to 6 cycles, and then they will be assessed with a scan and see the response. Now, if it doesn't work, the next option would be to go for further lines of chemotherapy. Usually, when the disease has spread to another part of the body, we don't do surgery or radiation for that matter.
Right, right. So anyway, we have talked about targeted therapy and immunotherapy, and now here's stem cells transplant. Ronismita Mishra, 32-year-old female, AML के लिए they got the stem cells transplant on Feb 22, 2022. And now I want to know the post-treatment. How long is it going to act and etc.
You see, now stem cell transplant, when we say, there are two types of transplants. One is known as autologous transplant and one is known as allogenic transplant. So whenever we say transplant, many times the families think about allogenic transplant, where the patient's bone marrow is completely what you call, we can say, destroyed or killed by chemotherapy, and from a sibling, that is brother, sister, or from a matched donor, the bone marrow, basically the cells, the bone marrow cells or the stem cells are given into the body of this patient. So this is basically like, for the person who gets that infusion, it's like a blood transfusion only, but there is a lot of chemotherapy. And suppose a patient does an allogenic transplant, an AML, it is usually an allogenic transplant where the person would have got the bone marrow or stem cells from either siblings or donors, post-transplant, it is very important that they are on some medicines for lifelong. Why? Because it is an external, it's a foreign thing, the foreign stem cells, no? So we have to be taking immunosuppressants. And now it's around 2 years for this lady, for 2 years that she has not had a relapse. So it's very good, and I hope she would be in the path to recovery and cure, because the first 2 years are very important. Still, she will have to continue some amount of immunosuppressants, which will help, which will maintain the whatever she has received to not get bad. So she will need some immunosuppressants. She will need every 3 months follow up, some blood tests to see that the transplant is working. So I would say that medicines and proper follow up, that is the most important thing for her.
Right, doctor. Thank you. So the next question is Dharma, but I think this is a very important question. My mother at 72 was diagnosed with lung cancer stage 4. And as a son who's 47-year-old, what are the risks attached to me? So this is a very important question. Genetic and hereditary
Yes.
factors that we did not talk about.
Yes. Correct, correct. So, this is again, as you rightly said, this is a very important question to address, and many families have this discussion once they have someone in the family getting diagnosed with cancer. Now, in terms of lung cancer, I would say that we don't have, there are some very rare genes which, if they are positive, there can be a family history of lung cancer, then there can be lung cancer in the family. But on an average, for a normal person, lung cancer is not genetic, it is not hereditary. Having said that, if there are common factors like passive smoking, now mother got cancer, suppose there is a family member who had heavy smoking, so that is very important. Many of the females, they would not have had smoking, and they come with cancer. They give history that their husband or their children are long-term smokers. So these smoking people should understand it's not only harmful for them. So that if suppose they, yeah, so suppose they have a common history of passive smoking, they can have a higher risk of lung cancer. But just because mother or father got lung cancer, there is no high risk. Having said that, prostate cancer, there is some evidence that if there is a history of prostate cancer, there is a higher chance of prostate cancer in men in the same family, and that is linked to a gene which we call as BRCA gene, or that's actually short form of BRCA, BRCA gene. Now, BRCA is a very important gene which has been linked to breast cancer, pancreatic cancer, prostate cancer, and even brain tumors. So, if suppose someone in the family, as we are discussing cancer in men, suppose there is a person who has two of his first degree relatives, say mother or sister, who had breast cancer, or maternal sisters, maternal uncle, aunts having cancer like pancreatic cancer, breast cancer, brain tumor. So they have higher risk of developing prostate cancer. So what to do? They have to meet a genetic counselor first. They should not go and do a test. They have to do a genetic counselor. In the person who had the cancer, there will be some test which I said BRCA 1 and 2. It's a blood test. So they do a blood test to see whether that genetic mutation is there. If that genetic mutation is there, then the person, like the unaffected person, needs to get a genetic testing. If BRCA 1 comes positive, they have a higher risk of prostate cancer. So hereditary cancers are mostly linked to some genes like BRCA gene. There is something known as P53 gene, which has a higher risk of colon cancer, higher risk of head and neck cancer. But on an average, lung cancer is not hereditary. Prostate cancer, breast cancer, and ovarian cancers have a hereditary pattern. Nothing to panic, but to be aware that if there is a cluster of cancer patients in the family, better to get a genetic counseling first, do a genetic testing first, then do the testing for themselves. So that is like a genetic screening for them.
Yes, doctor. So thank you so much for that very, very valuable information. And next question that I want to take up are the anorectal and the colorectal cancers. So Roy is asking, please do talk about colorectal cancer. And here's Nikhil Kumar's question. Brother is just 20-year-old and he's diagnosed with stage 3 anorectal cancer. Treatment is undergoing, but we're worried about the permanent colostomy. Is this the only solution? So before we answer Nikhil's question, can we just talk about the colorectal cancers and the anorectal cancers?
Yes. So as I told you, the colorectal cancers come to in worldwide is the third most common cancer in men, and in India, it's around the fourth most common cancer in men. So it's very important problem. So the most common symptoms for colorectal cancer is either an unexplained weight loss or hemoglobin going down, blood in the stools, no blood. So this is very commonly seen. I'm saying I have done my training from Delhi in AIMS and in Tata in Mumbai. Many times when there is a bleeding from the motion area or anus, the first people they meet are not doctors. They get a temporary solution with some whites, some people quacks who are ready to do some small procedures to stop the bleeding. We have seen people who are diagnosed with colon cancer having bleeding for last 1 year, and they thought it is piles, and they did not do, they did not meet any doctor. They took some medicines, and most difficultly they went to some local people who did some local, they say they keep some medicine and then it burns that area, so many things. And when they come, unfortunately they have advanced, and that is a very common thing. So one thing is, if there is a bleeding, I know most common cause would be piles, but it's okay to meet a doctor and get it examined. No, you don't need colonoscopy for everyone. A normal sigmoidoscopy or even a rectal examination will tell us the piles is there or not. They should not assume that it is piles. So colorectal cancer, one symptom is bleeding, second is weight loss, and unless it spreads somewhere, there won't be any other symptoms. That is the most difficult thing. Suppose it goes to the lungs, there will be breathing difficulty. Suppose it goes to the bones, it will be bone pain. So these are the two symptoms: bleeding, anemia, unexplained blood loss. We don't know from where the hemoglobin is dropping that way, and then the weight loss. So these are the three symptoms. Now, coming about screening of colorectal cancer, there is evidence that screening helps. Any person more than 55 years should undergo a simple test called as stool fecal test. So that, what does it mean? They give a sample of the stools or feces, a small amount. On that, a test is done to see whether there is blood in the stools. There are many very sensitive tests called immunochemical tests where they will say yes, there is blood in stools. Then they should get a colonoscopy. They will get colonoscopy, they will find some early cancers, then they can be treated. Suppose the colonoscopy is normal, then for the next 5 to 10 years they don't need to do colonoscopy. So they can do a colonoscopy and be assured that for the next 5 years they don't need to worry. But they have to do annual test for the stool to see whether there is blood. So it is known as two tests. One is fecal stool screening test using whether the blood is there in the stool. Second is colonoscopy. Now that is for the normal people, that is which who don't have a history of colon cancers in the family. Suppose someone has a history of colon cancer in the family, there are genetic syndromes which can cause higher risk of colon cancer. One of them is called FAP, that is called familial adenosis polyposis, which means they have a higher tendency to develop colon cancer. I am the second question regarding a 20-year-old boy having an
Yeah,
anorectal cancer. Yeah,
Nikhil
it
Kumar.
could be it could be very well, it could be related to a colon cancer syndrome where they develop these cancers. Now, how do we find out? Suppose again I said genetic counseling is very important. They will see that there is a cluster of cancers in the family. They will advise for genetic test, and these people who have a familial history of cancer, they should get colonoscopy much earlier. I would say 10 years before the cancer happened in the family, they should take a colonoscopy and see. And again, we have recently had this HPV vaccine,
Correct.
the HPV vaccine for females, no, 9 to 16 years, every girl can get HPV vaccine to prevent cervical cancer. Now there is evidence that human papilloma virus, which is causes cervical cancer, can also cause anal cancer. So in developed countries like in US, both boys also get the vaccination. 9 to 16 years, boys before they mature or they get into sexual activity, they get HPV vaccine, 2 doses for them. So that can prevent anal cancer, although it is not very common, but still that is an option for boys of that age group. They can get HPV vaccine. It prevents anal cancer. Now, regarding the question regarding whether bag is needed permanent, ileostomy. So you see, the rectum has three parts, and the lowest part is called the lower third of rectum, which is very close to the anal canal. So having a cancer in the anal canal or lower part of rectum, there is no way we can do a surgery and not have a permanent bag. There is now latest technologies like robotic surgery. They have acumen to do ultra low surgeries which can have temporary stoma, but no does not need permanent stoma. So if it is an anal cancer, the anorectal cancer means anal cancer are not treated with surgery. Anal cancer or squamous cell carcinoma we call are treated with radiation and chemo. So there is no surgery. But rectal cancer is treated with surgery. So I would say that, and it's very important that such patients are treated in centers where all the three facilities are there: the medical oncology, radiation oncology, and surgical oncology, or the gastrosurgeons, so that they can have a common plan, have a tumor board discussion, make the best plan, and do the treatment. So, rectal cancer should be treated, almost all cancers should be treated in a center with all the three facilities, because that is called a multidisciplinary tumor board decision. And that is very important for
Right.
cancer. So, I would recommend him to meet at hospital where there are all the facilities and then make a plan and treat the relative.
Right. Wonderful. So thank you so much for that valuable information. And then a lot of questions about PSA and screening. I think that people are worried about it. One quick thing: there are two or three people who are asking. I've seen this question where Tejpal Singh ji, 73-year-old non-smoker, no BP, no alcohol, no occasional alcohol, weight in control, regular exercise. PSA is below 1.5. Do I still need to get my screening done? Quick answers, sir.
No, no. You see, PSA less than 1.5 is very much normal, and he doesn't need to do anything. He just, unless he has any symptoms like urinary tract symptoms, we are not treating the blood reports. No,
Yeah,
you don't
yeah,
need to really worry about the blood reports. Once a year, he can continue to do PSA, but 1.5 is absolutely normal. And there are
yeah,
age criteria. Now, from Apollo itself, there was a study which said different depending on the age group they belong, the PSA levels can change. So at
correct.
75
Like, for
years,
example, here
some
I have Ekanta, 70-year-old healthy. A PSA is 10.2 today. I don't have any other issues measuring 4.3 into 4.6 centimeters. Do I need to get any tests done?
You see, PSA when it becomes 10, it is definitely on the higher side. But many times when there is something known as a prostate infection, we call as prostatitis, there can be a mild rise in PSA. So what we do is check the urine for any infection, urine culture, and we give a course of antibiotics for 1 week. After one
Yeah.
week to 2 weeks, we repeat a PSA. If the PSA is still remaining 10, then they should get a checkup by the urologist, which we call as digital rectal examination, and get an MRI to see whether they have an early stage of prostate cancer. So I would
Right.
say a course of antibiotics, wait for 2 weeks, repeat PSA. If it is not going down, yes, they should get it evaluated.
Right. So evaluations, all evaluations done. Mr. Javed, Mohammed Javed, he's been advised biopsy prostate. 60-year-old, PSA is 24. I have no other symptoms. Post-void has improved only 632 cc. And I want to know any non-invasive treatments.
Yeah. You see, prostate, first thing is for the diagnosis, as I mentioned before, please don't fear biopsy. It's the most important test. To even say out of 10, 9 times it may come no cancer also. So biopsy will confirm there is no cancer also. So biopsy is very important. So the next only biopsy, if you take it as invasive, don't worry, it is not invasive. There are many ways of taking biopsy, which is just like taking a sample for blood. So that is first step. Confirm whether you see PSA 24, very high chance that there is prostate cancer. It could be a early prostate cancer, and he takes a biopsy, confirms it. There are non-invasive treatment, and in that regard, I will tell about radiation. Now, prostate cancer has two options. One is, suppose the prostate cancer has not spread anywhere, then the prostate cancer has two options. One is surgery, which is called as prostatectomy, which can be robotic also. There are other ways also, but there is surgery. The second part is radiation. Now, in that context, we have the what we known as 5 days radiations are also approved for prostate cancer. There is 5 weeks radiation also. So, depends upon how much tumor is there in the prostate. And in that regard, we know proton therapy is one of the technologies that has helped to reduce the side effects of radiation. And you see, prostate is sitting just below the bladder and sitting in front of the anal canal and rectum. So when you are treating with radiation the prostate, many symptoms are related to the radiation that goes to the bladder and the radiation that goes to the rectum. So difficulty in passing stools, burning micturition, burning urination. So when we have something like proton therapy, radiation can be given directly only to the prostate, preventing the side effects. So that is one option I would say. But even otherwise, radiation therapy, there are so many technologies. We call it IGRT, where we can track the tumor and treat it well. So there are so many technologies which are non-invasive and can be treated. So rather than waiting for the cancer to become from one stage to fourth stage and become incurable, better to treat it with the latest technologies, whatever is available around. Still, it is possible to treat it non-invasively.
Wonderful, doctor. Thank you. So, one quick question that I did not find the name here. Paternal uncle of the husband had prostate cancer. Now, we were talking about BRCA gene. So, the wife is concerned about, should I get my husband tested for a BRCA test?
That is what I said. You see, when we have, because this is the age of information, everything is there on the tip of the fingers. And suppose she Googles Baraka, she will get very much frightened because there will be a lot of things. Now, one history of one prostate cancer in the family does not give any higher risk. So, what we have to do is we have to meet a genetic counselor or even a doctor in oncology and have a pedigree. We call it as pedigree charting, whether that uncle had any family relatives who had cancer. So we will chart above all the brothers, sisters. So if there are more than, apart from prostate cancer, suppose there is an ovarian cancer, suppose there is a breast cancer or a brain tumor, we identify that, okay, there is a syndrome which is running, and then only he needs to do a BRCA testing. There is no evidence, there is no new to do. He can do a PSA maybe as a regular annual checkup. He can do a PSA, but going to the genetic level of testing is unnecessary, costly, and we can cause a lot of concerns. So not advised.
Wonderful, doctor. Atish Nutan, father suffering from low platelets, wanted to try and increase the platelets from more than 4 years. Platelets in sometimes 50K platelets, sometimes it's lower, higher. Ames, Delhi, father, 72 years. This is a problem when you type your messages in parts. I don't get the question. So under the hematology department in Ames, what's your question? So does he have? All right, doctor, did you understand from the bits and pieces?
I
I'm
got
sorry.
it. I got it. You see, one thing again, platelets is a very sensitive issue because it is related to the dengue, and not people know what is platelets. So, one thing I would like to say to people here is there are many causes of having low platelets, and one of the most common causes is having something like a viral fever or dengue, which can cause the platelet to go down. But suppose the platelets are constantly low, and I have seen it in many patients that they have a deficiency of vitamin B12 or folic acid. So I would say before you go for a major bone marrow testing or a major scans or something, you can check vitamin B12 levels and folic acid. Vitamin B12 is even associated with a male pattern of baldness. So even alopecia can be caused to vitamin B12 because the vitamin B12 gets absorbed from the body in a very different way. Even if your diet has vitamin B12, it may not be absorbed by the body because there will be some deficiency, and you may need IV injections or some specific tablets which can absorb through the tongue. So my suggestion would be that he gets the vitamin B12 levels and folic acid levels tested, start the supplements under the care of a physician. Only still, if it's not improving, then only he needs to meet an oncologist or a hematologist. And the eating of papaya leaves and all will not help here, and there is no evidence. People do that even during chemotherapy. I find people going behind papaya leaves. In dengue, there is evidence that it helps in a different way. In oncology, some people use it, but it is not the way for all platelet load problems. So please evaluate the vitamin B12 folic acid levels. If there is a deficiency, do the correction, and we can see an improvement in platelet.
Right, sir. So one quick question, Kamal Vaidya, does peleotic as trauma grade 1, is this benign or malignant?
It's actually pilocytic astrocytoma.
Okay,
So
pilotic. Okay.
Yeah. Pilocytic astrocytoma is a common brain tumor that we see, and it's a grade 1 tumor. So it's not benign, it is cancer, but 90% of the time with surgery alone, they get cured. And if surgery is not possible because the location is very critical, with radiation, they get cured. They don't spread in the body, 95% they get cured. So it is a cancer, but it's a grade 1 cancer. Nothing to worry. The treatment would be surgery and if needed, radiation.
Wonderful, sir. So Tapanjyoti is asking, at 44-year-old, is there any blood test screening method to detect any cancer like stomach or colon cancer? Are the higher value of MPV and PW relating to any indication of cancers?
You see, at 45 years, if you do a blood test which can detect cancer at this point of time, there are some studies going on where people are doing what we call as tumor cell DNA and all, but that is all in a primitive stage. So, most important for a 45-year-old is to have good lifestyle, stop smoking, no, stop alcohol, have a good, you see, adopting yoga as part of the lifestyle, tremendous benefit will be there. Having walking, moderate 45 minutes of walking, avoiding obesity, having good food, that's all the things needed. There is no single blood test. You see, there is a tendency that all the risk factors are there, but we need a blood test. That is not true. Blood test, if suppose, as I said, there is a family history of prostate cancer or a colon cancer which is less than 60 years. Some patients have a syndrome, as I told, they can have prostate cancer, colon cancer less than 60 years. In that case, the family members can do the test 10 years before the person got cancer. So suppose someone got a prostate cancer at 55 years, at 45 years you can do a PSA test and see. But again, it is very much variable, it is not dependable. I would say adopting healthy lifestyle, being aware of your body, and removing the fear factor would be the most important thing. There is no blood test needed at 45 years.
Wonderful. Be aware of yourself. So I understand that we've
Yes.
covered most of the topics today, and there are questions which I can't take up in today's session. But Apollo 24/7 always brings you experts. You can just consult anybody. And if I'm sorry to paucity of time, I'll not be able to ask all the questions here. But Dr. Sujit, I must appreciate with the kind of the depth that you've answered the questions. We really appreciate it. So before we sign off, can you please give us how to address, how to increase awareness, or how to kind of prevent cancer? Top tips from you, please.
Again, thank you so much of direct questions you have asked. So five things I would say. First thing is be aware of your body. Any changes in the body, any new symptoms, please be aware. Second thing is avoid high risk behavior, alcohol, tobacco, having a sedentary lifestyle, no exercise should be avoided. Please have a good physical exercise, yoga, etc. should be improved. Fresh fruits and vegetables should be part of the diet. Third thing, head and neck cancer, be aware that there could be an oral ulcer which is painless. That is very important to be noticed. Lung cancer screening is done by CT, low dose CT, especially in people who have a history of smoking for more than 20 years or 20 pack years. They should get one annual lung CT scan done. And most important, know about cancer. There is no place for fear. If you know cancer, then there is no cancer. That's what I would say. Please be aware. Please have the knowledge. There is no place for fear regarding cancer. It is just like any other disease. We diagnose, we treat, and we get free of it. But prevention is most important factor.
Wonderfully said. No cancer, then there is no cancer. Awareness is everything and no fear. Wonderful, doctor. It is absolute
If
privilege to have you here on the show. Thank you so much for the
felt
time.
Yeah, thank you so much. I'm very privileged to be part of the talk, and all your questions were very, very relevant. And I'm thankful for facilitating the communication from the people who have joined also, Ms. Jhansi Laxmi. Thank you so much. It was a
Thank
pleasure
you,
to
sir.
be here.
Always, I thank my audience for being so wonderful because their question is not just their question, it's an answer for many
Yes.
people who are watching.
Yes, as
So,
you
thank you.
see, the questions that they have asked we have discussed genetic counseling, we have discussed the latest
Yes,
advancements, we have discussed the prevention, we have discussed the most
the
common
fear.
cancers. Yeah, the fear. No, you see, people are asking questions. Someone has cancer, should I be fear? No, there is no role for fear. So first thing they come to the OPD, they have so much of misinformation. Unfortunately, my first day, the 40 minutes I spent, 20 minutes is to remove that fear, because they unknowingly are, even if they don't have that problem, they fear that they will have something. So there is no road for fear. There is a need to be aware about the body. There is a need to be aware about cancer. It is going to be a big problem. I'm sure every one of us has someone in, I have my grandmother who had lung cancer. So everyone in our family will be knowing someone. So that is important. Whatever you know, you share it, and never
Correct.
ever be a part of a propaganda to say cancer will kill this and or no. Every cancer is different, and every human being is very, very different. Everyone is unique. So I would say personalized treatment is helping people. There is no need to be fear. Be aware. Be have the knowledge. No cancer. No cancer. I would
I'm
say.
leaving this show today with a little more stronger, with a little more richer with information. Thanks to you, Doctor. Namaskar.
Thank you so much. Thank you.
Thank Right, चलो quickly हम लोग कर लेते हैं health quiz. All the people who know how to participate, I know you're all ready and waiting, but people who are new to our show, and here comes the health quiz. I'm going to ask you 3 questions. You must be watching this on multiple platforms, but if you want to participate in the quiz, I request all the audience to hop onto YouTube, type your answers in the YouTube. I'm going to ask you 3 questions. The winners will be declared towards the end of the show, and winners will be selected in the sole discretion of Apollo 24/7 team. And if I am taking your name to be the winner, we request you to write back to us with all the contact details before Wednesday of every week to marketing@apollo247.com to claim your gift vouchers. Chaliye, let's start today's health quiz. The 3 questions for today are: question number 1, please fill in the blanks. Blank. Dash is the second leading cause of death globally. Dash is the second leading cause of death globally. Question number 2, true or false? Prostate cancer is the most common in men in ages 60 and older. Is that true or false? Prostate cancer is most common in men aging 60 and older. Is that true or false? Question number 3, is cancer contagious? Yes or no? Is cancer contagious? Yes or no? That's it. These are the simple 3 questions. The questions are on the screen, and please go ahead, type your answers. And here we go with our coupons that you can use on Apollo 24/7. Consult top doctors direct from Apollo, 150 rupees cashback when you consult, when you book an online doctor consultation. Use this code AskDoc150, AskDoc 150. And the next coupon that we give away is first 3. Use the code FIRST3 to get up to 25% off on online medicine orders. When you order medicines direct from Apollo, you get almost 2-hour delivery of medicines too. And here's a coupon for our Health Hour viewers, HH247. You get 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. So you must be knowing that Apollo 24/7 can be accessed on WhatsApp as well. Here are our WhatsApp numbers: 09355247247. Save this number. You can just call or text for your medicines from WhatsApp, which is very simple as well. And next week, ladies and gentlemen, we are talking about a very interesting subject. How do you keep your digestive system healthy? Because आधे तो हमारे बीमारियां हमारे गट से ही निकलते हैं, हमारे हैबिट से ही निकलते हैं, जो खाते हैं वहीं से निकलते हैं. So let's all talk about how to keep our digestive system healthy, to be very, very happy. This is next week, 25th of February, 11 a.m. We are going to talk about digestive system. And we are waiting for your questions. As Dr. Sujith was saying, we are looking forward for your participation, because your question is an answer for many. And here are our winners for this week: Sanjay Vakhalu, Atish Nutan, and Krishna Shastri. Can I repeat? And your names are also in the chat box. Sanjay Vakhalu, Atish Nutan, and Krishna Shastri. Congratulations, you are the winners of the health quiz for this week. Please do write back with your number, name, address, all your contact details to marketing@apollo247.com, and gift vouchers will be shared with you before Wednesday. Chaliye, thank you so much all of you for joining us today. No fear when you know about cancer. So take care of yourself. Namaskar.